Now that we've optimized the patient, we're now ready to consider surgery. Let's take a look at this diagram where you have the abdominal wall and different layers where you could put the mesh. You could do it as an onlay. You could put it as a bridge or an inlay, which most people actually don't prefer because it does not restore the continuity of the abdominal wall. Or you could do a retrorectus, a preperitoneal, or an intraperitoneal mesh. After choosing where to place the mesh, then we're going to have to talk about what mesh to use. Well, you could use multiple types. You start with, is it going to be permanent or absorbable? If it's absorbable, is it a bioabsorbable or is it a biologic? When talking about permanent mesh, there are multiple things that you have to consider as well. Based on their weight, are they going to be microporous or macroporous? What is the type of mesh that you're using? Are they going to be polypropylene? Are they going to be polyester or PTFE? And are they going to be coated or uncoated? Talking about coated and uncoated aside, we only use the coated version if we actually place it intra-abdominal. So if they're intraperitoneal, they could be coated. However, when you have a coating, it is harder to eradicate infection in these instances, and that's one thing to consider. The more inert one with less giant cell reactions is called polypropylene, and this is more commonly utilized. What are other things to consider? Well, we have the weight of the mesh and the porosity. And the general gist is the heavier the weight, the tighter the knit, and the less porous the mesh is. What is this good for? Well, it has a higher tensile strength, avoiding mesh fracture. So if you basically are doing a hernia repair on someone with a large ventral hernia and they're heavy set, then considering a heavyweight mesh may be better. However, what's the setback? If you get a mesh infection, you have a harder clearance of your infection on a tightly knit heavyweight mesh compared to a macroporous lighter weight mesh. And that's why choosing your mesh appropriately for the proper patient is something that you have to consider.